Good afternoon.
Hello, Your Majesty. This is Francois here.
Sorry, we live in a digital world.
That's very kind of you. We're all very patient and really excited of this opportunity to talk with you. I'm going to do a 1-minute introduction to leave the space to these amazing, incredible people who we are privileged to work with and privileged to recognize through the foundation. And so I will just quickly say a thank you from the Schwab Foundation side, Your Majesty, and your office requests every year to get a chance to speak to some of our social innovators. We've got an incredible group who are joining today, mostly from our 2020 cohort of new awardees and one from our 2019 cohort, all who work in areas that you are passionate about. I've briefly before this call spoken to them a little bit about the roles that you've had and the interest you've had and the commitment that you've had towards the Sustainable Development Goals, to children's development, to health, education, etc. So I don't need to do more of that introduction, but just to say that we're going to leave this like we normally do and allow each of the social innovators to introduce themselves for 1 to 2 minutes each. We'll do a round robin, and then we will really leave it up to you to have a conversation, ask the questions you want to ask.
Good day, Your Majesty. It's an honor and a pleasure to introduce Global Healthcare to you. Global is an innovative technology-based company that is trying to make healthcare accessible, affordable, and accountable across the world, starting with India. We are now in more than 10 countries in Asia and Africa. And with the help of one of our investors, UpHealth, we plan to take and make healthcare accessible all across 150 countries, especially in Asia and Africa. We go where no one is willing to go, in the most difficult areas, tough areas, hilly, tribal, rural areas, poor areas, and we bring the state of technology using telemedicine, Internet of Things, POCT, ultraviolet sterilization, and automation to make primary healthcare a reality everywhere. We have treated over 2 million patients and at less than $5 per episode. Our telemedicine Hello Life is like a telemedicine through an app and a web app between connecting patients and doctors. But more than that, it is backed by a clinical decision support system called Litmus DX that enables right decisions, right diagnosis, right management. The digital dispensaries of ours are extremely innovative. They allow not just video consultation, but remote examination using IoT, instant investigations using point of care technologies, and automated medicine dispensing through our dispensers, which enables complete primary care to be integrated back as it should have been. We have been at the forefront of COVID, treating patients in these difficult circumstances. And during COVID, we have expanded our services. We are in Philippines in the east, contracted in Namibia in the south, Mongolia in the north, and now in US. With transformations in US, we are planning to launch our first behavioral health or mental health AI.
And do you? And what about also in your clinics about the vaccination for COVID-19?
Currently, vaccination, Your Majesty, is being done by the government in India. And because of the low volumes, initially it is being delivered through designated centers. But in phase 2, we hope to be a part of it, and we will be able to deliver vaccination to people throughout the length and breadth of the country as the supplies of vaccines available for people increase. As of today, the online screening tool of ours for COVID identifies patients who need help, and the areas our analytics actually denotes the areas where requirement of attending to those areas is there, and we hope that we will be able to begin the vaccination part also very, very soon, Your Majesty.
And a last question, because we face a really a wave of number of patients with mental health issues. How do you face that with your clinics?
Currently, our telemedicine system has psychiatrists, psychologists, psychotherapists, to whom the patients can reach out and make health care, mental health available to them. But as I mentioned earlier, with Up Health and Transformations, we are going to launch our mental health, behavioral health AI, and hopefully it will be launched in October. This will be a very interesting tool, because it is not just when the patient reaches out, but because of these scales that are built into it from patient behavior and its metrics, doctors and healthcare providers can be this can trigger them to start taking action even when the patient has not yet reached out to them. This is especially important when these are silent patients who are not reaching out for help, and it is necessary to trigger and know when professional help is required by a patient. And I think this would be phenomenal. We are still in the early stages of its prototyping and developing, but we hope, Your Majesty, that it will be launched by October.
Thank you very much. I have other questions. Thank you very much.